Welcome back. You're listening to The Voice of Russia in London. I'm Brendan Cole. Now, the images shocked a nation when they were broadcast last year on the BBC Panorama documentary. It showed workers at the Winterbourne View care home near Bristol abusing patients. 6 workers were jailed for ill treatment and neglecting patients at the now closed hospital. And while Winterbourne has become a byword for cruelty, it has raised questions about how well suited the state is to caring for the vulnerable. With regards to the elderly, for instance, a report by the Dilnot Commission has come up with 2 key proposals. One would be that care costs would be capped at £35,000, and the other that support would be extended to the elderly with assets of up to £100,000. Is the British government able to handle the treatment of vulnerable people, both young and old? What are we to make of proposals to introduce a greater role for the private sector? Well, to discuss this, I'm joined by Randeep Ramesh. He's Social Affairs Editor at The Guardian newspaper. Simon Peyton, who's External Communications Manager at the not-for-profit care provider Anchor. Judy Downey, who's Chair of Relatives and Residents Association. And on the line we have Emily Holzhausen, Director of Policy from Carers UK. Randeep Ramesh, what did this Winterbourne case say about the state of caring for the vulnerable in the UK?
I think what it really showed is that there are, for too long, vulnerable people, elderly vulnerable people, have probably been marooned sort of in islands, unseen by the rest of the general public, where they have been subjected in some cases to terrible abuse. Now, in this case, the whistleblower, the nurse, had gone to the regulator and asked for an investigation to be launched into the behaviour of his peers, the fellow staff. The regulator did not take action because I think the chap was on holiday he was supposed to be investigating, and they never picked it up. And that highlighted a sort of flaw in the oversight mechanism. And secondly, it highlighted, when the case actually came out, highlighted a bigger problem, which is once the money is being paid to keep people in. Now, these people cost £3,500 per week. The company that oversaw Winterbourne View was making a lot of money from the National Health Service, actually. This was where the payments came from, via the local council. But no one was checking on what was happening there. And that's why I use the word marooned, that sort of out of sight, out of mind, and terribly abused in this case.
Simon Peyton, there were warning signs, weren't there? I mean, there was something like 76 visits by patients to A&E, and there were calls to police, there were safeguarding alerts. What does this say about how agencies share information with each other?
Well, we're quite concerned at Anchor about this. I think, everyone is in agreement, unanimous condemnation of what happened, and it's not reflective of all care homes. First and foremost, I'd like to highlight that. But we have done lots of research ourselves at Anchor, and it's highlighted that there is not a sort of disjunct between, people that are coming out of care into hospitals, and that's why we're calling for a minister for older people, so that there's one person ultimately responsible to make sure that incidents like Winterbourne View don't actually happen again.
Judy Downey, what's your reaction? Or is it just a failing across the board, or is this just an isolated incident, do you think?
It's not an isolated incident. We run a helpline and we get calls 5 days a week about poor care. I have to correct my 2 colleagues. Winterbourne was not a place for older people. It was for younger people with learning disabilities. And as they said, people were paying a hell of a lot of money. 3,000 was about the average. In some cases, it was a huge amount more than that was being paid by the NHS. And as Randeep said, nobody was checking. But it seems to me that it raises a huge number of issues, not just about the ghastly failure of the regulator, which we have big issues with. It also raises issues about how vulnerable people with long-term conditions are treated in this country. It raises questions about training, about the fact that anyone can walk off a job filling shelves and start working with the vulnerable people as though it doesn't require training, expertise. They're dealing with people often who can't speak up for themselves, who have challenging behaviour, who need the most skilled, loving care with other skilled professionals involved. So it's not just about the failure of regulation, which I think is absolutely essential. It's also about the failure of the people making profits. The Castlebeck organisation, which was shown to fail, which took action to shut the 2 worst places, and the regulator did nothing to remove their registration. If ever you needed proof that someone was unfit to make a profit out of misery, that was the case, and the regulator failed miserably.
I'll turn to Emily Holzhausen, Director of Policy from Carers UK. Judy Downey mentioned the issue of training. What kind of training is required? Is it really completely inadequate to deal with the demands of the job?
Yes, it is really. I mean, we represent families who care unpaid for their relatives. So the quality of care that, if they entrust the care of their relative or close friend to someone else, then the quality of care is absolutely important. And it's not just about the training and the skills that people have, and sometimes you can end up doing some quite complicated things with medication that really does require training, because when things go wrong, you could have somebody's life in your hands, basically. But it's not just about that. It's about compassion. It's about how we treat people. And I think we have a big disjunct between the regulation system and the requirements that people see for caring for children, for example, with anybody else who has a disability or a chronic illness that needs help. There's a lot of people can make decisions about care themselves, but a lot of older people and disabled people are very, very worried about complaining themselves. They worry that they won't get care. They worry that things will be taken, that action will be taken against them. And it's often family members feel worried as well, but often it's the family members who complain about this. And I think what we've seen is a failure across the board to act quickly and take these complaints extremely seriously.
You're listening to The Voice of Russia in London. We're discussing the government's role in care with Randeep Ramesh, Simon Peyton, Judy Downey and Emily Holzhausen. Judy Downey, the Count Me In survey found that 1 in 20 patients with learning disabilities in hospital said they'd been assaulted at least 10 times in the previous 3 months. Does that suggest that perhaps what the horrific scenes that we've seen in the Panorama documentary as recently as last night are being repeated across the country? That seems hard to believe, doesn't it?
Well, I think it's very difficult to know what the challenges are. I mean, some places that are recording assaults of this kind, it's very easy to be simplistic about it. Some of these will be resident on resident. Some of these will be poor and unskilled care, not intending to cause harm. Some of it will be really the result of the kinds of things we saw in the programme last night. But I do think that training is important. Of course, compassion is a sine qua non and everything to do with vulnerable people. But I don't think we'd allow children to be looked after by unskilled workers. We wouldn't think that a 12-week induction, which sometimes doesn't happen, is good enough. It's really about paying for the kind of care that these people need and also protecting them properly, because every child in need has a named social worker. We don't seem to be generous in this country to do the same for adults and older people in a similar position. There needs to be somebody who has the authority to monitor and make sure what's happening to them on a regular basis. It's really difficult, even if there are family members, to do that. Sometimes the places are too far away. Sometimes you're too old or disabled or sick, or not everyone has family. So it seems to me it's a public duty that we need to think about.
Can I just pick up on quite a few points that both Judy and Emily have made? I want to make training is paramount, and obviously at Anchor, everything is reinvested, and so I agree with what you're saying about the initial period, but there is really intense training over that 12-week period when they first start, so that they are able to care. And we definitely object at Anchor to what the government is saying about getting unemployed people to suddenly work with older people. We think that older people are fantastic people. They've contributed a lot to society, and so just to get people who have no experience to treat them is just unacceptable. I want to pick up about transparency as well, which I think Judy and also Emily were talking about. Transparency is really important, and that's why Anchor and quite a few other care providers within the industry are taking part in the Your Care rating system, where customers will be interviewed by independent people and audited independently. The results will be, and it will show where there are failings within the in the sector. And so this is where we're, as an industry, are trying to rectify this stigma that is associated with care.
Randeep Ramesh from the Guardian newspaper, I suppose it seems like all the anger was directed at the Care Quality Commission rather than on Castlebeck, which ran the care home. But really, I mean, its task was impossible, wasn't it? I mean, the Care Quality Commission, it's been created from 3 large regulators. It doesn't have the funding that it used to have. The investigations that it does is a lot less than it used to be in the past. This is a fundamental problem with how it's being implemented, isn't it?
I think some of that is a design problem. Some of it is in the behaviour and nature of the Care Quality Commission, because if you remember, they were informed by a whistleblower. Now, if you get a nurse working at Winterbourne View with people with learning disabilities and who says there's restraint, there's violence, many people would have thought the regulator should have acted upon that. And I think that's where we can accept that these are difficult times, and the Care Quality Regulator has a vast task ahead of it, because it regulates not only social care but healthcare systems in this country. So that's all fair. But I think in this case, in this specific case, they really did fall down on the jobs. And on a wider look at the Care Quality Commission, their behaviour has been inspected or been subject to quite an extensive public inquiry known as the Francis Inquiry, which is about failures to recognise what was happening at Mid-Staffs, which is a rather large hospital in central England. And the evidence that seemed to come out of there appears to show there was a structural failure from coming down from top management, which said we're not going to investigate things. It was very much a cover-up culture that they seem to be propagating. At least that's the allegation, and I think the evidence is very, very strong in that inquiry. I think, as far as the government are concerned, there's a separate point about private operators, which is quite interesting. They talked tough after Castlebeck about looking at the ownership, the colour of the operator, and seeing whether that was a problem. And eventually, after many months of political posturing, came up with basically nothing. They weren't going to privilege non-profits or state organisations above for-profit organisations. Now, a lot of this, I think, plays into what Emily and everyone's been discussing here about training, because the money that gets diverted into profits, it may be argued, could in fact be used to train people. And it's very noticeable, the difference in language between for-profit providers and non-for-profit providers on this issue.
At Anchor, all our money is reinvested into training. You know, dementia training is so important, for example. All our care staff, we're striving to make sure they have at least level 2 MVQ in care. It's so important. We value our older people, and we just wish that others would follow suit as well.
So, Randeep, back to you. Are we seeing a kind of philosophy here with the British government where, looking at the Public Services White Paper, and David Cameron, he regularly talks about excessive regulation and bureaucracy. This is a shift in attitude, isn't it, towards private sector involvement in the provision of care. So we potentially could see more cases like this, couldn't we?
Well, I mean, I think it's not to damn every private company as being sort of rogues or renegades or basically taking the money and abusing patients. I think that's a step too far. I think the question is about regulation of companies and whether you think more regulation is needed. This government has, its leitmotif is not to use regulation. It's to step back and say the state needs to retreat and we don't need, oversight. I think these cases emphasise the fact we do need oversight, and we need pretty robust oversight, and we probably need funded oversight. And these are the problems that the government's face. I think ideologically they think people should be allowed to get on with the job without the interference of a sort of huge bureaucracy. But I think that's that's ideology at work. Not every bureaucracy is huge. Not every bureaucracy is some intrusive kind of function. But it does need to intercept errors and put things right. And I think it's a difficult balancing act for the British government. I mean,
Emily Holzhausen, I'd like to ask you, actually, just with regard to the findings by Margaret Flynn, where she said that too many people were being sent far away from home. And in your position at Carers UK, a home environment is presumably the best environment for vulnerable people.
Families tend to choose different environments, whatever's best for that person. But what we're seeing, some people want to move away from home, which every young person should be able to do. What's difficult is when you move people a long way away, and then it's very difficult for mum and dad to get there, and brothers and sisters, and that is where the sort of checks and balances start to break down. There's no way we should be relying just on family for checks and imbalances.
Okay, but what about it? But Margaret Flynn made the point that people were being moved around like pawns, and
Yes.
this was detrimental, and this had to stop. If there was one finding that could be taken from her report, this would be it. What do you make of that?
Absolutely, no, it's critically important. People have to be in control of that. Would you or I choose that? No, we wouldn't. So it's not right. And the other thing to say, well, perhaps we should keep people at home, that's really not always an option as well. A lot of parents care for their young disabled relatives and become too frail to do so. And so it's very important that we plan for the future for our young people. In the case of Winterbourne View and people with learning disabilities, it is such a shock if a parent dies, if the main carer dies, and that young person doesn't have the life skills to be able to live on their own. So it's very important that we have a way of developing this for the future. But just because somebody moves out of home and they have a disability, it doesn't mean to say, and the same goes for older people who are married, to move hundreds of miles away or 50 miles away, those family bonds are usually really important. Just because you live in a home, you still have a community, so it's very important to keep that going. But I also wanted to make a point about good care, because good care does exist as well. And what's difficult is that we don't often hear about it. It's quite often spread by word of mouth. And where people do get good care, it completely transforms people's lives. And what's difficult about this whole debate is that all the care workers who work in this particular field feel completely demoralised by the poor care and the extremes from Winterbourne View, for example, that give their industry a bad name. And if we're investing in the future of care, we need confidence that we're really going to have a care system that is fit for purpose and supports people in our communities in the best possible way.
And of course, the care system for the vulnerable includes care for the elderly. And I'll turn now to the Dilnot Commission and its key finding, which caps individual liability for care costs. Judy Downey, do you think this is a good idea?
No. I think that Dilnot addresses one part of the problem at the moment, which is funding. It accepts the status quo on quality, which is something we've all been ranting on about, which is really what matters. It discriminates against older people. It says that the state will pay for younger people with long-term conditions, but it's a tax actually on older people and on dementia. I think that the divide that we have at the moment between social care and health is really one of the most scandalous things in this country. We get people phoning up all the time saying, my mother's had a stroke, or her memory's going, she's got Parkinson's and a heart condition, and she needs more care than we can give. And everybody assumes that it's part of the NHS because, guess what, they're ill. So the fact that that's means tested and goes into a different part of the system, that people who are at their wits' end then have to shop around, it's not really the answer to the problem. It's also the bit that everybody forgets, is that Dilnot kindly suggested that there should be a board and lodging charge on top of the other charges, which could be $7,000 to $10,000 a year. Most people haven't got an extra $7,000 to $10,000 a year. Most people haven't got the $35,000 that Dilnot talks about. We think in the Relatives and Residents Association that whatever your income, you ought to get good quality care, paid for by the state and paid for by all of us out of taxation, just as we pay for cancer and HIV.
You're listening to The Voice of Russia in London. We're discussing the government's role in care with Randeep Ramesh, Simon Peyton, Judy Downey and Emily Holzhausen. Simon Peyton from Anchor. I suppose a lot of people don't actually realise that the care for when they become old and more infirm is that won't be necessarily picked up by the state in the way that they think it can be.
Anchor's own research has found that 1 in 4 people are totally unaware that social care is means tested, and we think that MPs are playing on this. Successive governments are playing on this ignorance because they're not addressing the issue, and we think that it's about time that people Jeremy Hunt obviously took the Treasury by the neck and said, look, this is about time we address this issue because we're an ageing population. We're obviously going to find increasing problems with the ageing population, and this issue needs to be addressed.
Randeep Ramesh from The Guardian, what do you think? Do you think that this £35,000 cap, which is being talked about that's a subsidy that's going to subsidise the rich. It's basically protecting a kind of the middle class in a way from selling their assets.
It's very difficult to say for definite that it's a middle class thing. The idea that the wealthy benefit, the government has admitted to. I mean, of course they benefit because at the moment you receive help if you've got £23,000 in assets. Now they're raising that to £100,000. Well, of course the people who benefit will be people who have more than £23,000 and therefore obviously richer. I mean, it's all relative here. I'm very interested in what Judy said and the attack on Dilnot, because I do think there is a slight, there's a sort of consensus in political parties that all this needs to happen. And Dilnot has been very effective, and all three parties have been very effective, of transmitting a message which is, don't worry, your care costs will be capped. What people don't realise is they'll only really be capped if they go over the assets level of £100,000, they'll be paying for themselves. I mean, and that's the bottom line. Now, 1 in 10 people do have costs of £100,000. They have catastrophic costs. And what the state is effectively not saying is what Judy, I think, wants is universal insurance. A model which says people are getting older. This is not a fault of people. This is a fault of the state, which has encouraged longevity in people's lives without telling them about the costs of it. And I think this kind of Dilnot Commission is quite interesting in that we've had, I think, 2 royal commissions. This is about the 3rd white paper. God knows how many times this has been addressed. And basically, the state's representatives, the politicians, are selling people a bit of a pup in that they're giving a message that you'll be okay. In fact, most people won't be. And politically, this is quite a dangerous act because any party that wins the vote of the over 55s in this country can win the next election. That's how key the grave vote, the pensioner vote is.
Emily Holzhausen from Carers UK, do you think that this could be a push towards people looking to having care in their own home rather than going into a home?
People are moving towards having care in their own home anyway. The push is towards that simply because we have such a huge gap between what the state provides, what people pay for privately, and what families then make up the difference is enormous and growing. It's very difficult to tell about whether people would be more likely to go into residential care or not. The Dilnot model spans both residential care and domiciliary care, and we have 2 very different systems at the moment. The issue that we haven't touched upon, which is in the Dilnot report, which was extremely important, is that we also need more funding to go into the overall system because of demographic pressures. That the Dilnot report was a really important contribution to helping limit some of the catastrophic costs that people have, and it is progressive because there are different ages that people benefit relative to their assets. The issue that is also important is how much our basic system is funded. If we don't have that sufficiently funded, we will see increased pressures, let's say, on the NHS because people will be more likely to go into hospital. We're seeing rises in delayed discharges, for example, from people coming out of hospital back into the community because those community packages are not there. We're getting an increase in admissions that are based on people not having the right social care in the community in the first place. So what we're seeing is a system under pressure. And we have to see some change, because as Randeep very eloquently said, we've been discussing this for a great many decades, and we haven't seen change.
Judy Downey, I suppose there's not really enough incentives for people to plan for their old age. I mean, it's taken quite a lot to get people to plan for their pensions, for one, and now we've got this additional thing that's come along, and people are just simply unaware of it. There needs to be more incentivisation.
It'll never happen. I mean, if most people know they're going to get to 60 or 65 or 67 and they don't save for it, they can't. I mean, it's not human nature to. And so to think of yourself being 85 or 90 or 100, lacking capacity, not knowing who or where you are, if we got out of bed aged 40 thinking that, you'd go back to bed, wouldn't you? I mean, there isn't. People have to pay for their mortgages, their kids. It's just not real life. That's why a good society plans for us and takes the money away from us when we're earning for our future. The only hope for older people and for people with disabilities is for there to be a total system. Emily mentioned delayed discharge, which is the the posh name for bed blocking, which is the posh name for people wanting to shove older people out of hospital. Hospitals need to be there for older people. If you read Bevan, the NHS was actually essentially for the old and sick. Government ministers for the last 30 years have been talking as though older people are somehow intruders in this system who should be moved off fast. The system needs to be responsive to older people, and you can't expect people to pay for a lottery where it's something like less than 1 in 4 of those over 85 are going to go into residential care. Why take that gamble? I mean, why not the state take that over for us and make sure that it's not a postcode lottery whether you get a decent care home?
So, Simon, Peyton, I suppose if we accept that it's going to be very, very difficult to persuade people to pay for their care, ideas proposed, long-term bonds or things like that, aren't really going to appeal, are they? So something else has to be found.
We agree with Dilnot. We think it's a good start. We think that an insurance scheme, a mandatory insurance scheme, is probably the best way forward. We all hate paying, insurance tax and things like and that, but at least we pay it and it's then put into...
But wouldn't that make a more complex care system? And we'll have all these financial transactions will make things even more complicated.
Well, the question is it better to have the status quo where people are having to sell their homes, or should it be the responsibility of everybody to start putting away money? Preparing for care is what we say, as well as preparing for retirement. People should prepare for care. And we think that a national insurance system or something along those lines is probably the best way forward, because people won't do it voluntarily.
Randeep Ramesh, okay, we've got the findings of the Dilnot Commission. It seems to have divided people and certainly divided the media. I mean, could there be another alternative that would be put forward that would be more politically palatable?
I mean, I think Dilnot is going in the right direction because it does say we have a funding problem. And in the short term, I think the answer to the question is no, because I think the political parties have coalesced around Dilnot and see it as a sort of full stop in a conversation. So even the Labour Party have said what you need to do is look at the NHS budget and instead of that money being clawed back by the Treasury, the Labour administration, so the Shadow Chancellor says, would use that money to fund social care. OK, fair enough, but what you're doing there is taking money from the NHS and then putting it into the social care system, which to me sort of is problematic. I don't think the public will wear it. Local councils are seeing their budgets cut, and the demographic pressure means that they have much more responsibility, which is why I think 80% of the 152 councils actually only give free care to really quite needy individuals. This really can't go on. I think at some stage, because we are getting older, and I think there comes a tipping point when you've got 15 years of life left, age 85, that's a lot of money that you're going to have to save up in order to rescue yourself from financial oblivion. And I think all of us have had personal experience of that. We see it, and I dare say with people we thought were quite wealthy, but have been reduced to quite poor circumstance through the fault of nothing more than having Parkinson's or having Alzheimer's or having dementia, and that is a function of growing old. And I think the political parties are too afraid of dealing with the kind of money problems, the kind of amounts that they are looking to spend or will need to spend later on, to be honest with the public right now.
Well, sadly, we've run out of time, but I'd just like to finish by thanking my guests, Randeep Ramesh, Social Affairs Editor at The Guardian newspaper, Simon Peyton, External Communications Manager at the not-for-profit care provider Anchor, Judy Downey, Chairperson at Relatives and Residents Association, and on the line, Emily Holzhausen, Director of Policy from Carers UK. Thank you very much for joining me, Brendan Cole, on The Voice of Russia.